Now we're going to look at some of the non-pharmacological strategies which can support babies with NAS. Key non-pharmacologic care practices can help ameliorate or diminish symptoms of neonatal abstinence. These babies require routine monitoring and assessment utilizing the Finnegan Neonatal Abstinence Scoring Tool, or FNAST, every 2 to 4 hours. A low stimulation environment is essential for these babies to facilitate sleep. They may be irritable and have difficulty maintaining sleep for extended periods. Soothing mechanisms can decrease irritability and facilitate sleep. These include flexed position, swaddling, slow movement during care, and rocking. Babies experiencing NAS have difficulty coordinating suck, swallow, and breathing. Promoting proper flex positioning during feeding is essential. Avoiding skin breakdown from excessive movement or from diarrhea can be accomplished using skin barrier products.
FNAST helps nursing staff assess for central nervous system, metabolic, vasomotor, respiratory, and gastrointestinal disturbances. The tool assesses 21 symptoms most frequently observed in opioid-exposed infants. Each symptom is assigned a score. Higher scores are indicative of increasing withdrawal from prenatal opioid exposure. Use of the FNAS is covered in Lesson 3.
Thanks, Amy. Did you know that when environmental stimulation is reduced by placing babies in single rooms or in modifying rooms with 2 to 4 babies, it has facilitated a reduction in length of stay? Low stimulus environment limits the number of people in the room, as well as decreasing conversational noise. All who enter the care area must abide by low speech levels. The sleep pace should be away from sink, telephone, equipment like ventilators, intercom, hallway, or people noise. The lighting in the environment should be darkened with spotlighting away from the infant's sleep space. The ability to simulate day-night levels while minimizing overhead room brightness will assist the baby to transition to home after the baby has been stabilized. Sleep is promoted when the baby is cared for in a special, separate location, in a nursery, or in a single-room NICU. A single room may also be used on a dedicated pediatric unit. This example of single-room care depicts a low-stimuli environment. The baby in a single room experiences less noise from people, equipment, and unit activity like phones. Natural lighting that can be readily decreased or left into normal day-night light patterns can decrease stimulation from light. Single room also facilitates parent education and participation in care. Here is another look at the single room care environment. This picture shows an example of a dedicated 4-bed unit for babies exposed prenatally to opiates and or other drugs. Note the natural light without overhead lighting. Staff and care providers whisper in the unit to minimize sound. No through traffic is allowed to minimize noise. Multiple sounds from equipment, alarms, phones, and personnel can be overstimulating to babies experiencing NAS. This NICU has attempted to decrease light stimulation on one side of the room with a softer blue light. There is no natural outside lighting, which limits the ability for day-night cycling of light.
In addition to low stimuli environments, swaddling the baby in a flexed position with hands to the face to allow for self-consoling can also facilitate calming. This simulates the intrauterine position. Position the infant in a flexed supported position with hands in the midline. This will promote neurodevelopment and assist the baby to calm himself or herself with his or her hands. Nesting the baby by using support products or blankets rolled into a U shape will promote calming and flexion. This simulates the intrauterine position. Position the infant in a flexed, supported position with hands in the midline. This will promote neurodevelopment and assist the baby to calm his or herself with his or her hands.
Pacifier use promotes self-calming with non-nutritive sucking. Massage has been shown to result in increased weight gain. Babies also exhibit fewer stress cues during and after the massage sessions. Caregiver rooming in provides one-to-one observation and the care of these babies. It also facilitates teaching of the baby's specific stress and calm cues to the caregiver. One way that babies may calm are to place them for short periods into a device that simulates various slow natural movements. These may be the simulation of being in a car or a figure-8 movement. Soothing ocean sounds may also be simultaneously used during a rocking or swaying motion. The devices should be set on low motion and less than 50 dB sound. Music therapy may be advantageous for babies experiencing neonatal abstinence. In preterm and small for gestational age babies, it has been shown to be beneficial since the baby responds by improving heart rate, sucking, and feeding abilities. The sound of the ocean has been shown to increase the amount of quiet, alert state as well as oxygen saturation in that population. Research on the use of music therapy in babies experiencing NAS is currently being conducted in a multi-center trial. Outcomes to be assessed will be heart and respiratory rate, oxygen saturation, activity, sleep, and feeding behaviors.
Frequent feedings, that is every 2 to 3 hours, may be required initially due to increased metabolism during neonatal opioid withdrawal. The infant may require an increase in caloric intake. This is facilitated by utilizing formulas or enhancing breast milk to 22 calories per ounce. Currently, there is no data to support the use of lactose-free formulas for these babies, since lactose is not the substance that creates the increase in peristalsis or diarrhea from neonatal abstinence. The increase in acetylcholine results in the diarrhea from rapid stool transit time. There is also no current data to support the use of partially hydrolyzed or partially broken down protein formulas. While feeding the baby, limit stimuli by not rocking, talking, or stroking the baby. Ask others in the environment to limit talking as well. Strong odors or body fragrances may be overstimulating to the infant. During the feeding, position the baby in flexion to maximize sucking and swallowing. Note how the caregiver has the baby's shoulders and elbows in a flexed position. The baby's head is fully supported. Extensor posture is a position that may produce stress and difficulty feeding.
Breastfeeding or use of mother's milk is highly beneficial to both the mother and the baby. Each mother's breast milk is matched to her baby. Breastfeeding may increase clean time, no illicit drug use. For a mother who's been using drugs, she is more likely to relapse immediately after delivery or when she stops breastfeeding. Each facility must have a policy on the use of breast milk. This includes use of breast milk from active substance users, including verification of no active illicit drugs, clean urinalysis, ongoing drug treatment, and planned support. Assess mom's history and active treatment for drug use, using the brief negotiated interview and active referral to treatment, BNI, ART, or other tool. Mothers who are in a treatment program with planned support are more likely to not use drugs or to stay clean. If the mother has physical indications that she is using, she must be apprehended. She must be approached about the use, and a urinalysis may be requested to assess for drugs. Breast milk should not be tested for drugs, since the timing of results may take up to a week. Assess the baby for increasing signs of NAS in relation to absence of mother's milk.